A great honor for us to be here this morning on another edition of Health Talk. The Mama Lume Health Talk platform is a 1-hour program that discusses a wide range of health-related issues. It brings you face-to-face with health professionals and provides you with causes, signs and symptoms, complications, and preventions of diseases and illnesses affecting us in our respective community. According to the United Nations Population Fund, every day in developing countries, 20,000 girls under the age of 18 give birth. And this amounts to 7.3 million deaths a year. And if all these pregnancies are included, not just birth, the number of adolescent pregnancy is much higher. Complications from pregnancy and childbirth are the leading cause of death among adolescent girls. Now, almost 20 to 25% of all women who die of childbirth in Liberia are teenagers, even though they make up fewer than 10% of mothers in the country. Adolescent pregnancy generally not a result of deliberate choice, but rather a consequence of little or no access to school information or health care for those young girls. International Women's Day is this month, and many organizations recognize women and honor women around the world. The Department of Health had various educational activities on the practical, such as contraceptive use, family planning, and pregnancy awareness. It aims to raise awareness about the importance of contraceptions and the prevention of HIV and AIDS infection. Today, we focus therefore on contraception and pregnancy. We'll be joined in studio by our special guests from Lydia Contraception, Mistress Flomo Edna and Kanfi Saki. They are both the county community representative, and Dr. Lauren Bian Stephanie, student doctor studying Doctor of Pharmacy at the University of Liberia. He is a 4th-year clinical student with an aim of specialization in obstetric medicine. He earned his BSc in chemistry and biology from the Cotton University with a magna cum laude. Congratulations, wow. Dad.
Thank you.
You may want to be part of this show by simply asking the panelists some questions or just sharing your view with us. The numbers to call is 0770-107-107, 0886-107-107. Please do not forget to follow our Facebook page, Mama Lume Health Talk Platform, and do subscribe to our YouTube channel, Mama Lume Health Talk Platform. So sit back, relax, and listen to this educated health talk coming to you just after a short break. I am RN Mama Lume, and this is Health Talk.
Begin at tuneslibeer.com. We are Project Liberia. Mama Liberia. Must all rise. Let's stand together to fight with all the leaders.
We live in a generation.
Everything is possible. It could be your mama, your papa, brother and sister. Let's stand together.
So welcome back to another edition of Health Talk. On today's presentation, we'll be discussing on contraception and pregnancy. And I have with me Mistress Comfort Edna from the contraceptive or Lydia Contraceptive, or sometimes I can see Lydia
Liberia.
Pure, sometimes I see TKT Liberia. So come from Miss Edna, welcome to Health Talk.
Thank you. Thank you.
And next, opposite her or far from her is Miss Kanfisaki. Miss Kanfisaki, welcome to Health Talk.
Thank you.
And we have with us in studio our young doctor, Dr. Lawrence Bian. Welcome to Health Talk.
Thank you. It's a pleasure to be on the show.
Thank you so much, and thanks you guys for coming. Okay, let's start with the basics. Let's start with Dr. Lawrence Bian, right? So we're talking about contraception and we're talking about pregnancy. But sometimes we often hear people talking about contraception and also talking about family planning. What is the meaning, or what do we mean of contraception, and what is family planning?
All right. Thank you so much. Contraception is basically the prevention of pregnancy.
Okay.
And for contraception, it is also called birth control, or it is sometimes referred to as family planning. But strictly speaking, contraception refers to preventing the sperm cells and the egg cell from joining. That is fertilization. So normally we know when there is when there is sexual intercourse, there will be fertilization. And fertilization is the fusion of the male gamete and the female gamete to produce a zygote that has 46 chromosomes. I'm sitting on this show, I have 46 chromosomes, you have 46 chromosomes. So it means that from either of our parents, from both parents, we have inherited 23 both. So who's some of them make 46 chromosomes? So normally, that particular fertilization takes place within a specific part of the female reproductive tract, which we call the fallopian tube.
Okay.
To be specific, in the fallopian tube, there are two portions. They have the ampulla and the isthmus. But 99% of fertilization takes place within the ampulla of the female reproductive tract or the fallopian tube.
Okay, so 99% of pregnancy take place in the ampulla or in the female reproductive tube. And sometimes you come across ectopic pregnancy in this step of pregnancy. So you're talking about ampulla and that of the fallopian tube. So can you just please make that vivid for the audience?
Yes. The fallopian tube is where fertilization takes place. In the fallopian tube, there are two regions, or there are two parts within the fallopian tube. One is the ampulla and the next one is the isthmus. But specifically, the ampulla region of the fallopian tube is where fertilization takes place. So if fertilization is occurring outside of the fallopian tube, it is a time it becomes an ectopic pregnancy. So at times you get pregnant within the muscles. At times the pregnancy go outside of the fallopian tube. When that happens, that type of pregnancy is called an ectopic pregnancy.
So any pregnancy outside the uterus, yes, it's referred to as the ectopic pregnancy. So let us move to Comfort. Comfort, welcome to Health DKD
Liberia.
DKD Liberia. So can you please tell us about DKD Liberia?
Yes. Thank you for giving me the audience. I will not tell you all about DKD Liberia because it's a large entity. Yes, so we have, so if I sit there to explain all about DKD, we'll not move on here today, but I will just be brief and tell you, DKD Liberia is a family planning NGO that's been in Liberia 3.5 years now, and we talk about our brand mostly because we are new in Liberia. So we here today we'll be talking about DKD products and we'll be talking about contraceptive.
So we will come back to the product and contraceptive. Let's move to Miss Saki. Miss Saki, in terms of approach use, I'm talking about your product, right? In terms of approach use of the word family planning and looking at the range, right? It is appropriate for us to use the family planning, or should we rather use the contraceptive?
Wow, if we're talking about family planning and contraceptive, it's almost the same. So, if we go out there telling people that we want you to use the contraceptive, not family planning, will be like confusing them. So we when we out there, we telling the people that we want you to take the family planning because they understand it that way. Except for the other people that will tell you that, or except for the educated one, then you'll be using contraceptive. But for the lower class people, you tell them that, oh, we came around to encourage young girls to get on a family planning, and we're going to name our products, which will be the Sayana Press, the liver plan, the IUCD, the condom, the OCP, and the ECP. So after telling them all that, we're going to ask them which one, because we are not choosing for our client. So we asking them which one they prefer. So if you would tell me that I want the ECP, I want to take the ECP.
Okay.
The ECP is the emergency. The
Emergency
ECP is the
pills.
emergency pills, right? So I'm going to tell you the benefit. Why are somebody benefit? I'm going to encourage you. Explain to you about this ECP and give you some of the benefits of ECP. But everybody don't have the same.
Yes, that's what I wanted to ask. Does it refer to all ages or?
No, once you like masturbating and then you having sex, you can get on our family planning product.
Yes,
So we would be like, oh, because most people will tell you that, and I'm born yet, so I don't want to take the implant. I prefer the tablet. But trust me, what if you don't remember the day, or you don't remember that you're supposed to take the tablet 8 o'clock in the morning? So what happened to the day that passed? Okay.
So the public have, don't go back to comfort. Do the public really have access to information when it comes to the DKT Liberia?
Sure. I may be correct. I will tell you like 85% Liberian know about DKT Liberia, because we as a county community representative, we are assigned in federal communities. Like for me, I assign in Painesville Bell, and I will, yes. And when you go on the field, you talk to people, they will want to know more. People come around, especially in a populated community, people will come around, they will want to know, what is family planning? Some of them, people got different mindsets for family planning. So in general, when they are in group, you tell them family planning it's when man and woman, husband and wife, girl and boy, boyfriend and girlfriend, decide to have a baby, and the spacing of them. Then you can go to what are the different type of family planning we have. They will tell you, oh, me I own 5 years. We will tell them DKT has 3 years family planning, which is the liver plan.
Okay.
Yeah.
So as a county community representative, how many counties have you visited?
Well, DKT have like right now, as I speak, some of our CC area they are in the rural area.
Okay.
We have visited almost 14 counties in Liberia.
Oh wow.
Yeah, and we work with like 180 clinics in Monrovia.
In Maserati.
In Maserati.
Okay.
Yeah.
Okay, thank you so much. So let us go back to the doctor. Doctor, when we talking the tea, we give you. So let us look at the word contraceptive. How far you think young people understand the word that when it comes to contraception, knowing about it? How far do young people, especially in Liberia, really understand what is contraception?
Well, I think it is a word that at times people need to listen to, and contraception, as I said, is the same as birth control. So sometimes you tell people contraception, they're like, I don't understand. You say birth control. Say breath control, I don't understand. Say family planning. So family planning is the one that is all around town in Liberia. So you say this is family planning, this is family planning. But contraceptive methods has basically 2 types.
Very good.
We have the
just
barrier
about to come
methods.
to that's another method. You're so smart.
Yeah, we basically have the hormonal methods, and we have the barrier methods, and we have other methods. For the other methods, we'll look at the natural planning method, the natural family planning method. Under the natural family planning method, we have the REM method. Under the REM method, sometimes it's called a Kalana method. It is called a calendar method. It is the safe period method. So at that time, this particular realm of calendar period method depends on ovulation. So from the time you start having your menses, you start seeing it. For the natural family planning method or the calendar method, you pick up your calendar and calculate 14 days.
Yeah.
When you calculate 14 days, you mark day 14. From there, you calculate 3 days before day 14. You calculate 3 days after day 14.
Good.
So you have realized that in total that you have what? 7 days. The 3 days before, the 3 days after, and the 14 days that you have marked.
Yeah.
Those 7 days are called your unsafe period. Those 7 days are your filter period. Those 7 days are the days that you'll be ovulating. So if you have any sexual intercourse in the interval of those 7 days, you are going to get pregnant. So to prevent that, you use your calendar method. But it's difficult. It is very difficult for most females.
Yeah.
They don't remember it. They don't even know how to calculate it.
Yeah, because it is not taught in school, because like family are not really taking the initiative to teach girls and young women about their health, especially when it comes to menstrual cycle, right?
Yeah.
Because if we're taking our time like to teach girls and young women about menstrual cycle, definitely they're going to know after your 14 days, count 3 days before and count 3 days after, and that's your unsafe period. Once you have sex during that day, you're going to get pregnant, right? So it is not safe for you to have sex, especially when you on your ovulation, right, Dad?
Yeah.
So thank you so much. So do you think the level of accepting, do you think that people really let me ask the educated Liberia people, because they in the field always, do you think that people really accepting the product and really want to use it?
Oh yes.
So how many people you interact with that they really use like the condom, like the pills, like which one?
Like
which
for
one
the
they really
condom, you have men coming for condom.
Okay.
Like when you only feel
Most of the time,
most
men will
often,
volunteer because
you
we
see
know.
them, yeah,
But
you
that's
see
women,
them going
they
for
will
the
always
condom.
be shy.
But if you look at the product, we notice that our long-term mental are growing faster, which is the implant and the IUCD.
Sure.
Because the people will be like, once I take it for the 3 years, I go in like whole 3 years before I can come back. And other people will be like, okay, and here you told me the other time it helped in and doing fertilization when it comes to the IUCD. Once I take the IUCD like 9 to 12 months, and they remove it, I can get pregnant. So you'll notice that most women are having difficulties in getting pregnant. They will want to go for the IUCD. So we will have our promotion. Like for the one time last year when I was signed across, I had like 200 plus. Like in for the just the liver plan.
Okay.
Yes, and the IUCD I had like 56 from Simple Bridge. And around that Simple Bridge bell, I had people from Douala, I had people from Simple Bridge, and I had people from Cardwell, few from Cardwell, because we have other clinics in Cardwell. And we have people from Broadway that came for the product. So the people already coming for the product to admit.
Okay, so I often hear you saying about IUCD. So the people listening to all, what they call IUCD?
Yeah, IUCD is the intrauterine device.
Okay.
Yeah. So it's like an
Intrauterine
contraceptive
contraceptive
device.
yeah.
Intrauterine contraceptive device.
Yeah.
Yes. It's a T. It's in a T form.
Yeah.
Because I know your Sarah, when I'm speaking serial, will be local too.
I know.
Before I say you start speaking serial in a studio. Yeah, it's in a T form. Like can be inserted into the uterus to prevent pregnancy.
Yeah.
And first of all, with DKT, first came to Liberia, like people are finding it difficult to go for IUCD. When you go, you tell them about IUCD, they will, listen to you, give you ears, but once you get to the facility, and
So the IUCD is like this, right? Something
yes,
like this.
like I said, yeah, in a T, yeah,
Alright. Thank
in
you.
a T shape. So you were convincing, they will agree. Or some people say, I got 7 children. I really want, stop because I want to pay attention to my kids. I want to get them better education. So I won't go for the 10 to 12 years on. If you get to the facility, When am I putting it? Then I say, oh, you insert it into your uterus, they get afraid. So we got it difficult for the first time, but now
People trying to understand the.
people most take over IUCD.
Okay.
Yeah,
So
like
because of
like
our culture,
yeah,
you don't get
yeah,
just opening up to
Yes.
people. You say,
Okay.
what? Am I going to lie
Yeah.
and open my legs
Like,
for people to look
yeah.
at so that mine
Yeah.
set
Set.
they will be like, no, I prefer taking the 3 years.
Okay. So
Yeah.
what are some of the myths you come across when it comes to contraception instead of the family planning or other stuff? Because they're listening. What are some of the myths here? Oh, I can't tell anything because people say this will
Yeah.
happen.
So
Okay,
many.
so you will not you will find girls saying that family planning thing, because you go on the field, you will finish talking everything. After talking, you'll be like, Somebody will just be like, Mama, what happened? He said, Ma, I'm interested, but why? He said, no, that family planning, my friend told me, she took the family planning the other day, and then she started bleeding.
Yeah.
When she went to the hospital, the person that gave her the word didn't say anything to her, so she went through it for some time until it finished. But now she okay, so I'm not prepared for that. So you will find people saying that. But when you like on the field, you want to convince them, somebody can change. But
Actually,
somebody
yes.
not all the
Actually,
time.
you have to be convincing. That she said they will tell you that, oh, and I'm not really taking it because since I took it, I left bleeding to it was completed. And besides, some people say I took that 5 years and it lost one in my arm. It lost. How is that possible? But to call all long matter short, we can tell them, TKT Liberia, the cleanest right way in Liberia, they facilitate them. We are assigned to, they train their own doctor, they train their own midwife, nurse, they train them.
Okay.
TKT has trained doctor who carry on the liver plan, who do that installation. We got trained doctor that do our installation to all of these facilities. We got a doctor who do IUCD, we got doctor that do our liver plan, we got people who do the cyanide press, and they know it to the best of their ability.
Okay.
So since we started working with TKT, for us 60 hours, we are now already encounter problem like, oh, and that product you gave me, it's not treating me well though. We know every choice got side effects, but it's not treating me well though. And somebody say IUCD for me, and I got problem for me. I've not encountered that on the field. So
Okay.
TKT is doing extremely well.
Okay, thank you so much. Thank you. So if you are listening to us out there, the numbers to call and be part of this show is 0770 107 107 0886 107 107. So call and be part of the show. Call and tell your experience when it comes to contraceptive pills, that your family planning. Today they got 3 months. They got
3 years.
3 years. They got
3
the
to
daily
12
on.
years.
Like just call on.
Yeah, so this is about 3 months.
Okay.
Okay, when you go to the facility, nobody going to miss this, but you already miss.
Thank you.
This is a cyanide
What
press.
the name? Okay.
This is a cyanide press.
Okay.
It's already missed. It's
Yeah, we got a caller on
self-injected.
the line.
Okay.
Good morning. Your name and where are you calling from? Oh, we lost that caller.
Come on.
I cancel his call. Good morning. Where are you calling from? Sorry, I cancel the other caller call. Good morning. Your name and where are you calling from? Oh. Good morning. Your name and where are you calling from? Fatu, welcome to Health Talk. Oh my God, we lost her. Good morning, your name and where are you calling from?
Good morning. My name is Lucien Kamara. I'm calling from Broadway.
Loseni Camara, welcome to Health Talk.
Thank you very much. Let me appreciate our doctors in studio.
Okay.
You see, when it comes to this pregnancy, sometimes, and this about is going to the doctors. They have to increase more awareness to the parents, because the parents, sometimes the children begin 13 to 14, to 15, they try too small to take family planning. And then you will make the children just lose at the end of the day, they will not end school and then take pregnancy as well. They pay when they turn 250% at the end, when the child out of high school, they will not get child support, they will not get child support. All of these things, at the time, the parents can be, delaying until when the children get into, special activities.
Okay.
At the end, you see them with pregnancy. So, these doctors have to do their best to bring more, awareness to the parents, to educate the parents on the health. The effective measure
Sure.
of this family planning for
Okay.
children.
Thank you so much. Thank you for adding your first.
Thank you.
The line when you talk about family planning and contraception on this line, like the line we keep passing. Good morning, Anime. Where are you calling from?
I'm calling from Couple.
Couple, welcome to Health Talk.
Yeah. Yeah, I'm here about discussing about the clinic.
Yeah.
Yeah. I want to share something with you.
Okay.
2014, I took family planning, but I'm a tell I get someone for me.
Okay.
Someone in here. But then I took the family planning and I ain't go for months. Well, it's 3 months. I go to the clinic for everything, my check on everything. After I took one, I can't not talk one, but my stomach gives me heart and I say I drop it.
So which one you took? The tablet, the implants, which one?
And the injection I was taking.
Okay.
Yeah, but then I grab it and I want to get move on my stomach very important.
Alright, couple. Thank you for calling. We discussed that. Good morning, Anime. Where are you calling from?
Yes, good morning. My name is John Flomo, calling from Harrisburg.
John Flomo, welcome to Health Talk.
Yes, I did the doctors in studio. I want to first of all appreciate for the kind of education, especially for our society.
Mm-hmm.
But there was something the doctor was saying, I just can't remember his name, but you are trying to talk about safe area and unsafe area.
Yeah.
3 days before and 3 days after. So I'm a bit confused.
Okay, keep listening, yeah? You will understand. I think we will also try to make that a specific topic to try to discuss it and call the doctor on board to see how best we can really educate people about their safe period, because that is one of our challenges. People are really, you see most of the teenage pregnancy that because they don't know their safe period, and when you tell them about contraceptive drugs, like they don't want to wait because they are somehow afraid. Some of them got a myth that you were not born again. Some of them got a myth that, go for me. When I take it, I will be bleeding until death. All type of stuff like, yeah. But this also help you to plan yourself. It also help you to plan yourself well. So you can keep your call coming. I think we have to accept 2 more calls, because the time, we already out of time today. Like 1 hour is not actually important when we're talking about health issue, right? So you can keep your call coming 0770-107-107-0886-107-107. Keep your call coming, call and share your experience. I want for somebody to call and share their experience to say, good morning, Anime, where are you calling from? Oh, we lost that caller. Keep trying. So let's go back to the doctor. Somebody was asking about, especially that safe area, like how many days before you have sex and how many days. Good morning, Anime, where are you calling from? Good morning, Anime, where are you calling from? Ibrahim Sefa, we are not getting you clearly. Welcome to Health Talk. Yes, Sefa, welcome to Health Talk. What's your concern? Okay. We are not getting you. Hello, your name and where are you calling from? Hello, your name and where are you calling from? I have to cut his call up because I wasn't really getting. I think you can call back. We're not really getting your question, and he's trying to ask some very logical questions, but I think he needs to call back so that we can get his question clearly. So doctor, tell us. Oh my God. Good morning, your name and where are you calling from?
Good morning, my name is Tina. I'm calling from the Oro.
Welcome to Health Talk.
Yes. Technically, you were discussing today. I really get interested in it. I was taking a planning before. I was taking a 3 months. I took it for 6 months. But then the planning, this time I took it, I'm not even receive. I take the first 3 months, I'm not receiving at all. The next time I started to take it again, I started believing it sometimes. I received 3 times, 1 more time. So now I received 1 time, and I 2 times like that. So I did it.
All right, thank you so much. The doctor will discuss it. DKD librarian will discuss it. So like doctor, you hear the other call. I think we are not going to. Sorry. We can't accept call now. Oh my God. Good morning. No, we can't accept call now. Let me disconnect because we don't have time in our favor here. There's no time in our favor. Doctor, you hear the person we're talking about the safety period, right? So what do you have to say about that?
Yes, that's the REM period, which we also call a calendar period. And that
we're already late. Yeah,
in that particular time, it depends on ovulation. So if you start receiving at that time, from the first time you start seeing your menses, you pick up a calendar and calculate 14 days.
Yeah.
We calculate 14 days. At day 14, you mark it day 14. So if today is the 18th of March and you start today, the 18th of March, you pick up a calendar, you calculate 14 days, including this day. At the 14th day, you are marking it. Then you are doing a backward calculation of 3 days backward and a 3 days forward after the 14 days. So that's somewhat to be what? 7 days in total. Those 7 days are your unsafe period. Those 7 days are your fertile period. Those 7 days are the days you are ovulating. Those 7 days are the days you are releasing rep eggs from the ovary. So if you have sexual intercourse or coitus in those 7 days, you are going to get pregnant.
Definitely. So my brother, I hope that answers your question. So you can be the man. You also have to be smart when your woman is receiving. Just take the calendar now. Let you know the woman. The minute you need to help. Unless you're ready, when you're not ready, just visit DKD will help you to prepare yourself. So ladies, you hear most of the call they were talking about when it take the injection or when they take the medication, most of them they bleed. Sorry, I'm not accepting any Most of them they bleed, and sometimes some of them they don't see their message. What
one couple from Oro just said, I want to add to that. And family planning in general, if you taking family planning, like she said, she was on the injection. And once you take family planning and you're not seeing your menstruation at all, it's working for you. When you're seeing the family planning and your period counts on that 2 days, 3 days, it stops, it's okay for you as well. I hope you're listening. Yeah,
the audience, she
okay.
Get your
It's
answer.
working for you. So that experience you are having is not a major problem for you. So you can come by, couple, please.
Okay, thank you so much, couple. If you're listening to her, if you're listening to Comfort, you can come back and they will see how best they can help you. So, doctor, I will come to you, please. I will come to you. We don't have time. I just want to brush over some stuff. So, how effective is condom when it comes to preventing pregnancy?
Yes, for me, condom.
Ladies, you will come in too because I know you brought your condom to explain how effective it is, how the person can place it, all this stuff.
Under the contraceptive method, condom has been placed under the barrier method. Under the barrier method, it prevents the sperm from meeting an egg. So for the condoms, they got 2 types. They got the latest and they got the polyurethane. The latest condom is the rubber, while the polyurethane is what you call the plastic. For the condom, it is safe, but it can burst. So you must better advise your client. And it varies from person to person how they had a coitus or sexual intercourse. So because it can burst, it means that it is not 100% guaranteed. But for the condom, it is preventing 2 things. The condom is preventing pregnancy and it is preventing STIs
and STDs.
And STDs. To a worst case scenario, HIV. HIV, to be specific. So if you want to go for the family planning method, tell your partner you'll go for the condom. Because if you take the Depo-Provera, which you call the injectable that goes for 3 days, if you have the implants into you, you take everything you want to take, and you stay having sex without your partner protecting, the other partner protecting him or himself, you are going to get STDs. And at the end of the day, you are going to get what? HIV, the worst case scenario. So please, let's use the condom and let's use it diligently. The condom is okay because it is preventing 2 things. Not just pregnancy, but STDs and STIs.
Okay, so you want to come in. What's the difference between a male? And this is one of the things we observe, that we see male condom almost everywhere, but it's difficult to see female condom. Why? You see male condom there.
It's just seriously, it's hard to
it's
see.
hard.
It's very, very difficult. You always find male condom. But the male condom, you
Sorry,
always
caller, we are not accepting any call. You already out of time.
for the male condom, you always find people going for male condom instead of female condom because to admit you don't really see, I just feel you will find like people telling you that, oh, I have or I saw it before. Some people will tell you that thing you have been talking, I didn't even see it before. I wouldn't hear about it. And somebody will say, I just hearing it.
Okay.
About the female condom. Somebody will tell you, I just hearing
Of
it.
course, most of them don't even know it. They
know
haven't
it,
seen it. Like,
so we
I don't know if you brought some so you can show it to them. Like, I don't know.
We didn't bring
No,
our
we don't
female
have
condom
that.
today. Yeah,
Like,
we don't have
have
This could be the female condom. This right here could be the female condom. This is the female condom, right? This is the
Yeah.
female condom.
Yeah, that's the
Yeah. Then the male condom, but everybody knows.
Yeah, everybody knows.
So, Dita, what can we do to try to at least minimize teenage pregnancy? What can we do to try to at least minimize it? Because it's hard to get rid of it. Yeah, because we're trying, but what can we do to minimize it?
It's a challenge. It's a national problem. It's getting global. For Liberia, we need to carry on many awareness like this, like we are doing, sitting in the studio today and discussing family planning. We must be able to inform the public on various methods or options that they have.
Okay.
That's one thing, awareness. We must be able to carry on awareness for
Definitely.
the general public. It is a good thing. Many girls are dropping out of high school because of pregnancy.
Sure.
Many girls, they are getting damaged because of pregnancy. I saw a case at one of the health facility where a girl got pregnant and she went to a nearby facility to do an abortion. And the goddamn girl certain pill blasted the entire uterus. When she got at the facility, she was experiencing incomplete abortion. So the only way that could save her was hysterectomy, complete removal of the uterus. A teenage who is going to live with a trauma for the rest of her life. So it is a wake-up call for every one of us. We must be able to educate the general public. We must be able to let people provide the information on how to complete teenage pregnancy or how to reduce Liberia infant mortality rates.
Okay, thank you so much, Title. I think our major focus is the awareness. We really need to do awareness, especially in communities, in various schools. We just need to keep talking because this is our challenge that we're facing. This is one of our challenges that we're facing in Liberia. So thank you so much for coming. Let me go back to Miss Saki. Miss Saki, can you just give all your party comment in that of your advice?
Well, I encourage young girls in Liberia and out of Liberia that to prevent maternal mortality in Liberia and out of Liberia, we want you to go and get your family planning, which is the contraceptive. We have different methods now that people were doing before that were causing problem for them, but now I assure you,
It's advanced.
it's advanced
So
now.
which one here? Which one here?
There's
This.
a condom. This
Oh,
is
which-
the classic
Which one of the condom here? Male condom?
male condom.
Oh my God, I thought I was female condom.
So we have different contraceptive now. You can go and get any.
Okay, Miss Shrey, can we get your parting comment in that of your closing statement?
Yes. Thank you once more. It was amazing being here. I really enjoy it over here. But my message to our young girls, our big girls, older women, not just young girls, because older women to make a mistake.
Sure.
Yeah. The people we interact with every day, we know what is going on. We have that going all over Monrovia because it's a big area. But people will set you down, you will go, you explain, they will tell you, oh, and I just need your number. After I will talk to you. So we got urging you guys, please. We got all types of family planning in DKT.
Sure.
Anyone you want, we got it. So please make it your duty, come to DKT or just have a lady, call our hotline 5585. Anytime on your phone, we will pick up anything you can understand. We will make you to understand. So young girls, we need to plan our family. Children need to be planned before you born them, please.
Of course.
So thank you today, and it was amazing. Yeah.
Thank you so much, and
I hope to have a longer time next time so we can do better.
Thank you so much, and thank you for coming. So let us move to our doctor. Doctor, we want to hear your parting comment and your closing statement.
I want to say thanks to the Mama Wa Health Talk platform and the Hot FM family for having this show. It's educative and it's necessary. And we must, as health practitioners, sit on the platform as experts on medication. We must be able to inform the public that taking family planning is good. But most of the family plannings, they are steroid medications. And steroid medication has side effects. Sorry, ladies. I'm doing the right thing.
We have to say that,
Yeah. Steroid medication has side effects, to be honest. And many young people that are on these family planning pills, they are coming down with hypertension.
Sure.
Yeah, coming down with hypertension. Let's be honest. That's it. Yeah, they are coming down with hypertension because steroid medication will inhibit cyclooxygenase.
Apart from steroid medication, all drugs have side effects.
It has side effects.
Sure.
So anything that goes into the system will be able to, as doctor or pharmacist and sitting on the platform, it is good to promote a product.
Yeah.
But it's also necessary to inform the public
But
about the side effects.
Oh,
So
yeah.
you have to be aware. Many people calling that, oh, I can't see my message, I can't see the one happening.
And these things
these are the
happen.
side effects of the medication.
Yeah.
So we need to discuss it. So please, it is good to take the family planning, but you have to be aware that you have many side effects. Hypertension is one, metabolic disorder, diabetes is another one. We get many people that are coming down with diabetes, though they're young people.
many young people.
They are coming down with diabetes because they are on this family planning. They have to be aware. Many people are coming down with hypertension as well. They are on this steroid medication. They have to be aware. And they are also experiencing high deposition of fat. They are getting weight gain. Many people on the family planning, they are getting fat. They are around. It's the effect of the family planning. So it is good. We want to be back on the show. I want to appreciate the whole FM family. We want to discuss more about the family planning, and I'm grateful to be here today.
Thank you so much. Thank you so much. So this is how we come to the conclusion of today's edition of Mama Lume Health Talk platform. Thank you so much, panelists, for coming. Thank you for educating us on these various issues, especially when it comes to contraceptions and that of this. So this show is proudly sponsored or brought to you by Honorable DJ Blue. Thank you so much for allotting us time in studio to always discuss health issues that are affecting us in our various or respective communities. We want to take this time to also thank the Hot FM family for always being with us when it comes to giving up of delivering health issue. Remember, we'll be back on air next week, Thursday, same time, same studio, so do join us. If you missed any of our show, any of our video, you can go back on Facebook or on our YouTube channel and just log in Contraception and Pregnancy, and you're going to enjoy the fruits of your labor. So thank you so much. Thank you for coming. God bless you.